Welcome to the HealthspanMD Podcast. Welcome to the HealthSpan Podcast, where we talk about the science of longevity. Today's guest is someone who sits at the intersection of medicine, technology, and innovation. Dr. Abbaszadegan is a double board certified internist and clinical informaticist. We are going to talk about that shortly as well. He was the former program director of the Clinical Informatics Fellowship training program at the University of Arizona College of Medicine, Phoenix. Today, he serves as a physician executive with Stanson Health, where he helps develop AI-driven clinical decision support systems that are transforming how care is delivered. In this episode, we'll explore how AI is and will be shaping the future of healthcare, from improving patient outcomes and reducing clinical burden to using data, AI, and technology to make smarter decisions in real time. This is going to be a really great podcast. He has a great perspective on this. Welcome to the HealthSpan Podcast.
Absolutely. Thanks for having me.
Oh, it's such a pleasure.
Honor.
So I immediately asked you after you gave this brilliant talk about AI and the future of healthcare to an organization that we both belong to recently. And I'm like, man, I got to get this guy on our podcast because you had such brilliant insights. I mean, everybody's talking about AI. Would you mind just sharing with the audience kind of your vision for that future and how AI is going to impact clinical care?
Sure, absolutely. So, when I think of AI, really, it's broken down into four components, which is machine learning, which is data pattern recognition. Then you have natural language processing, which is like Siri on your phone and Google Home and Alexa. And then there's a factor of reasoning of that data and then planning. So when you break that down, and the reason I do that is look at machine learning has actually been around for a very long time. In fact, credit card companies use it for fraud detection, looking at patterns of purchases. And Amazon uses it with their market basket analysis. So one of my age-old examples I give is chips and salsa. So if you go to your Amazon app and you type in chips, you will get options for chips, but you'll also get suggested purchases for salsa. So as a human, well, I like to eat chips and salsa. It's very obvious. Machine learning is not alive, but it sees data pattern recognition, and people that buy chips tend to buy salsa. So from a marketing perspective, let me throw both in front of you. So if you do and mess around with that, you get a lot of funny other searches. I spoke to the American Dental Association a number of years ago, and I Amazon searched toothpaste, and I got toilet paper. So again, not really related, but then again, kind of is if you're buying toiletries. So it's really interesting how data pattern recognition has evolved. Fast forward to where we are today, especially with the use of large language models, that's really red hot right now, really since 2022, coming out 23 and advancing even more. That really stemmed from a lot of research back from the use of natural language processing. But the ability to synthesize text and formulate things and really spit things back and forth in a natural component is very natural to people. And the use has catapulted within just the last year and a half. In fact, I joke with some people, but I was at a music concert and I had to use a restroom. And as I was coming out, I heard two guys talking, "Hey, bro, just throw it in the chat GPT." So it dawned on me that, oh my God, even for basic communication, people are going to use this type of augmentation with how they communicate. So AI, where we're at today, is really involved with a lot of help with decision support. It's a big buzzword, especially in medicine. We call it clinical decision support. And the use of large language models to kind of bring that to how you're going to communicate, how you're bringing things together, and how we're going to be using this information synthesized by AI engines to help us make decisions.
Yeah, that's such an exciting area for this. One of the things, I've been a physician long enough that I remember when I first was coming up, we still had paper charts.
So did I, by the way.
Is that right?
Yeah, so I'm in that club too.
Yeah,
yes.
So we had this, we used to call it the plumber chart at Mayo Clinic, and it was this plastic thing with, stuff full of papers, and they had to get it to the next appointment and this big complicated system, and you'd write the note. And it was brutal because half the time you couldn't read what they said. And, there was kind of a shortcut thing. Well, then we go to EMRs, and that was a brutal transition for us as well. I mean, the data is that the doctors now spend 2 hours in a clinical or in front of a computer screen for every hour they spend actually in front of the patient to document. How is AI potentially going to help us get the information that we need and then also document that in a way that is going to ease the burden on the physician, but also give the patient the right information as well?
Yeah. It's a really good question. I was of the school of paper writing too. So my internship year in internal medicine was 2009. And I trained right here at Banner, and we were using paper charts. And their lab information system was electronic, but by 2010, they pretty much transitioned to Cerner full blown, and we were typing away. And as you know, over the last, 10, 15 years, from my standpoint at least, we've created this massive note bloat of all sorts of information, of which so much of it is not relevant to what you need to know.
Yep.
So when we talk about how AI will help, again, there's elements of AI, and then there's that full-bore AI. So elements of AI have been around, like we've discussed, like machine learning, but we've had these dictation and documentation tools that have gotten better. And now we have a lot of this ambient technology that's out, so active listening and use of large language models, kind of pairing all these things together that basically, based off our conversation, can decipher what parts of the note we're at, what we're talking about, and then tee you up to do things. So if we're talking about in a primary care visit that, oh my God, you're behind, you haven't had your colonoscopy, when you go to sit down on your note, everything is nicely documented, and then you have a prompt to sign an order to refer to GI doc to get a colonoscopy. So based on my perspective right now, I am seeing coast to coast hospital systems in a very deep pilot mode on a lot of this ambient tech. It's not widespread. It's still expensive. Those that use it love it. Not everybody uses it per se. Personally, I'm a very fast typer. I use smart templates. But even the electronic health record company Epic has said there's 2 ways to document, and one is using this technology. The other is using smart templates. So definitely it's going to help. It's going to make things faster. It's going to slot things. And it's going to tee you up and allow you to really go back to the focus of the human touch and interaction component. So that's in play. I think it's not widespread yet, but that's coming down.
Yeah, we've been using an AI note taker, in our office for I don't know, maybe not a year, but 9 months, I would say. It has helped us with our notes. I will say it has hallucinations from sometimes.
Oh, yeah, for sure.
I read that note and I'm like, where in the world did it get that? But the other part of this has been really helpful for patient care is that it auto creates a email to the patient summarizing the visit. And as you know, it's a universal experience for us as doctors is that we can have a 30-minute conversation with the patient about a certain topic, and then later they say, well, we didn't talk about this. And we're saying, well, yes, we did. We spent 30 minutes on it. I realize now it's just that they're overwhelmed, right? It's an emotional conversation oftentimes. Yeah. We're throwing lots of things. And even if we're doing our best to translate medical speak into people speak, it's challenging to do that. I think that's been a thing that my patients have really valued is that. And is that something that you're seeing more well in the world out there? Oh yeah, a lot of the auto-generated summaries of the summary of the visit, and then components of what you discussed, recapping, patient education. Absolutely. Yeah. Absolutely, we're seeing that being used. So there was a research thing, I didn't read the whole study, but just the headline of it, that an AI-supported clinical evaluation in an urgent care center was actually more accurate and a diagnosis than just a physician without the AI support. the little bit of experience that I've had with using AI in clinical support has been helpful, but it's been me directed, meaning that
totally.
I see something and I'm like, it's not my area of expertise. I'm going to look it up, and I'll use chat or open evidence or something like that, and I get an answer now that's perfect for what I'm looking for. I could see where we can have that more more accessible, like, totally. Earpiece maybe that I'm like, as I'm talking to the patient and it's formulating thoughts and feeding me information that would be helpful. That's a future as well, right?
No, absolutely. I think there's no doubt we're headed towards a lower cognitive burden. In fact, we've seen evidence of that, and more use of your time doing something else. And not spending as much time searching, you getting to your answer that you need as the physician. Therefore, you can translate the use for a particular person, right? Everybody's different, but at the same time, as we know from medical school, when people get cut open, they're the exact same. But what pertains to you and the circumstance you're in and where you're at mentally is going to vary with everyone. And so we are still going to be in the business of translating this information and how it pertains. So more people will have access to this, and your summaries are going to get better. But again, how does it pertain? Are you ready to make a move in this direction for your health, or you're not ready? I think that human side is where we're going to be spending more of our time with. And I think that personally, that's exciting. That's what we always wanted. That's where you feel good as a clinician. Patient feels good, because every interaction with a physician, especially if it's not like a well visit, is very overwhelming. And I still practice hospital medicine, and those interactions are very intense because you just typically had a very near-death experience. So, we're going to continue to be translators regardless of how good this info and the summaries are. So.
I don't see this as replacing, physicians. Who knows what that future looks like, but, at this point it's enhancing our skills. And especially when, the healthcare provider supply is in dire straits. I mean, not only are we underserved now, the future is not going to get better. I mean, with population declines and things like these are getting in, aging population. These are going to be big problems. We're going to have to get more efficient. And this is it. I'm going to just ask you a bold question.
Sure.
5 years from now, 10 years from now, whatever time frame that you want to put on this, let's say that what's that vision of healthcare? What's different than now that you see technology in contributing to at this point?
Yeah, there's so many different ways I can go with answering this. I think that it's going to be a combination of you having your assistant and decision support ready, and the patient having that ready too. And so we're all going to be a little bit more beefed up with our knowledge base with what we're attacking, okay? And so what is it you want to do and why you want to do it is going to become to the forefront of things, right? And, as docs, we see patients smoking, especially with cardiology, the effect that has on the vasculature. So it's a lifelong type, well, I shouldn't say lifelong, but it's a long-term type of behavior that affects things downstream. So what are we going to do about that when people don't feel anything different at the moment, right? Your AI engine will tell you that, well, if you keep smoking, you're going to have a heart attack at this age. I mean, maybe we'll get to that. If I computate and input in your genomics, your family history, the dose of the meds you're on, your labs, the amount of time you're visiting, right? There's so many good computational models that on July 7th of 2032, you will have a heart attack, right? Maybe we'll get there. In fact, I don't think it'll be that far off, right? I put in the address to this office when I got here, and I got spit out an exact time that I would get here. I ended up beating it by a couple minutes, by the way. I take pride in that. It's another conversation for another day. But nevertheless, we got this information. I know exactly, based off of where I'm today, where I'm going to be at. So just as sometimes I might, take pride in getting to my destination 2 minutes earlier, what can I do and what do I need to change to modify that outcome I don't want, or to modify what I'm doing to get the outcome I do want. So I think behavioral components are going to be way more integrated in all sorts of practice. Not saying that we're all psychiatrists, but you're going to have to step by step go through things, and there'll be moments in life where people will want to do it, then they won't want to do it. It's kind of like addiction components where relapse is almost a part of the process until you finally get to your desired outcome.
That's fascinating. So that predictive ability, you're exactly right. Like if we can show people that future, that's going to impact current behavior. And
you would hope so. I think in some cases it still might not. I have 6 years. Well, I'm going to go out tonight and that's it. Exactly.
Well, I don't know. In a prevention world, I've heard that before, and you've had this experience as well. It's like, sometimes the pushback is, well, some people aren't going to change, and I'm like, yeah, I can't help those people, but what about the people that will? What about the people that this information, and one thing that I hadn't thought about before, but I want to get your thought about this. You have this conversation as a hospitalist on a regular basis is what are the risks and the benefits of different options in treatment? And that is a real challenge for us as human beings. We're not very good at assessing risk. I will have a conversation with a patient and let's say they're high risk for heart disease. Whatever reason, they had a calcium score, they had a heart attack recently, and I say, well, I'm recommending a statin for you to lower your future risk of heart attack, strokes, and death. And they will say, yeah, but I read that statins will kill your liver, and my third cousin on my mother's side, took a statin and they developed, some problem from that. And so I then have to go through but look, your risk of dying of a heart attack is this big. The risk of you having a problem on the statin is this big. But how to explain that in ways that people understand is really challenging. Yeah. I think if AI could help us with that, right? They could even give us a chart, like, okay, here's 100 people, and this is how many are going to die if they don't take the statin, and then here's 100 people, and this is how many are going to have a side effect that really is meaningful, and then it gives them the visual where they can say, oh, I get it, like that's a possibility of this.
Oh,
right?
totally possibility, and everybody knows someone that had a different effect with that med, and you're exactly right. How do you combat that? And that's, I think, where that art of human connection comes. True. You, as the doc, have to convince me to go through this or take this medicine. And again, maybe AI will help. Maybe AI will slow it down because it's telling me I don't need to worry just yet, or my risk is not really there, so I'm just going to procrastinate on this. I think it's a whole new subset of issues from convincing that will have to take place. And Dr. Google has been around for quite a while now, and I feel like in many ways it's helped, in many ways it hasn't, because if that doesn't pertain to you, then that doesn't matter. And your cards that you have today are going to change. And so the game of life that you play is going to constantly evolve, and what was working for your cousin might not work for you. So I think that art of the human connection is something that I keep coming back to. No matter how good we get with predicting things and how good we get with disease process, that's going to be there. And, there's a lot of prediction of AI being able to formulate more curative approaches towards diseases. But are those pills or those interventions? There's still like a lot of things you have to do. There is a physical component to stuff. Like if I'm dehydrated to the point where I'm in the hospital, I'm going to have to put an IV in. So, you know what I mean? That physical aspect and decision-making is still going to be very complex.
Yeah, absolutely. But being able to get the information to the patient and the doctor that they can use in the moment to make better decisions, how powerful that would be.
It's going to be amazing. I mean, it's something that we were promised in 2009-10 from my perspective with electronic health records. And to some extent, certain things were good, right? Your lab result was back. It was way off the range. I mean, we got processes in place to get a hold of me and flag in the chart. And so we take action faster. doctor. So some stuff is good, some stuff became overwhelming. So I think getting smarter with just that component of getting the right information to the right person at the right time is going to continue to be critical, and what action you have to take at that moment will continue to be a big deal.
You know, I can also see how this, is going to help us with a more precision approach. You know, there's so much information now. You know, we can do genetic testing. We can download all of. If you've been tracking your health on Apple Health, we know your steps from years ago. Blood pressure, lab testing, imaging studies. You know, you can imagine a future where that patient or that person has all of their data in a way that is, searchable, analyzable. That they can talk to a doctor. I'm sure you have the same issue as I do. Oftentimes I can't make decisions because I don't know what the information is. They'll say, well, I saw this doctor 2 weeks ago, and I'm like, yeah, but I don't know what what they said. And they're like, oh, but I had that lab test, years ago, but I don't have the result. Or there was an imaging study that that the patient tells me what they think it was. Yeah. But then I get the report and it's completely different than that. This could help tie that all together, so I don't have to.
Maybe. I mean, there's still issues with interoperability. I think synthesizing some data will get better, but if we don't solve the problem of interlinking things, then we could still have problems. So there are some potential solutions that are out there, and there's this, APIs or application program interfaces where you can kind of plug and play into different systems and gather that information. I think will continue to be a big reason why we can hopefully overcome this problem of not having the right information when we want to make that decision. So no,
that's an exciting future to me. Natural language processing. Can you tell us what that is and what's exciting about that?
I think, natural language processing is really, the way I think of it is using your Siri. So you're just talking into a device and it's basically able to synthesize that, and it spits back to you some response in a natural language. So you might say, hey, Siri, remind me in 10 minutes to check on the stove if you're boiling water. And then in 10 minutes you get an alarm that goes off. Or, okay, I'll remind you. So there is a science to it, and this whole Markov model, and we can get into all of that, but it's a little technical on kind of how it came about. But really it was I see it as the origins of where we've gotten to with large language models. So in a nutshell, it's just Google Home, Alexa. It's something you've used for many, many years. It's just all about synthesizing language and text. And so kind of the rendition we're in now is more of this large language models, and now you're fusing all these things together. So that's where we're at with Ambient and that type of technology that can listen to our conversation and document a note for us. So that is one root tech that I see a component of AI, but now as these dots are getting connected, we're seeing how the full potential is becoming full bloom. But my son has a Alexa in his room. Both my kids do. So he talks to it every day and tells us what the weather will be. He's 6 right now. And he has this umbrella he bought not too long ago. So if there's any inclination it might rain, he gets excited to go grab his umbrella.
Here in Phoenix,
exactly. It doesn't happen very often, but he'll tell us if a package is coming. So again, he's not getting on a computer. He's not really doing anything. He's just talking to this device, and it's kind of getting him info that he needs at the time. So I think that ultimately, in a nutshell, it's just kind of like C-3PO from Star Wars. It's an assistant that's there, can talk to you, can translate for you. It can decode things for you. It just gets you the info you need at the time you need it, regardless of the language of the other species in the case of Star Wars. So
that's interesting because I've thought one of the futures that I see for AI potentially is along those lines, because I realized this years ago when I was on the hospital service. That was when I was the happiest. I worked the hardest. I had a lot more stress because the patients are sicker and all those things in the hospital. but I loved the work. And why did I love the work? It's because I worked with residents and fellows. And so when I had just a spot on team, like of rock stars, I knew like within 2 minutes, they'd tell me the story and I knew exactly what I needed to know to make the decisions that, and I would let them make the decision and I'd only correct them if they were off track, but it was fun. Whereas when I'm in the clinic, I had to put it all together, right? And I'm like, wouldn't it be cool if I had the world's greatest fellow in my ear all the time? And I'm like walking down the hall, going to see Mrs. Smith, and I say, what's up with Mrs. Smith? And they give me, all right, so Mrs. Smith has this, this, and this. This is the things you need to worry about. This is the lab tests that we're concerned about. And we need to, talk to her about this. Boom. I just walk into the room and I'm on it, right? That's what you're talking about.
Totally. I mean, I think these technologies basically are like having your own resident, intern, or fellow. And in fact, my hospital that I cover, I work with residents, fellows, and students and interns as well. So I mean, they do a lot of this information digging and present it to you at the moment you need it. So I mean, it's the greatest thing, but when most don't have that, they're out by themselves, then it becomes burdensome. So this is kind of that cognitive overload, the efficiencies. These are all the early victories or low-hanging fruit that are getting solved actively.
Yes. So, one of the things you do is you're part of the HSI Foundation Standards Board. Can you talk about the importance of creating standards in healthcare, and what concerns do you have that you think we need to put up some fences or barriers?
Totally.
Around?
I mean, so standards really are essentially like guardrails to some extent, but it's also making it so that everyone uses the same thing, the same process. And my personal favorite standard is a USB-C charge port because it charges my phone, it charges my laptop, it charges my other devices. I have a GoPro, it charges that. I mean, I have like 10 devices. So now if I travel, I only need one cord to take with me, not 10. Although if I have 10 devices, maybe I need more than one, but that's another problem for another day. But ultimately, that's how I view standards. And the European Union really pushed for that to force Apple to stop using the Lightning charger. So when I talk about standards, I always use that example because we're living it now. Some people are still on older models of phones, but as you upgrade your tech, all your devices, from a charging perspective, are using the same standard charge.
Thank goodness.
Exactly. So when it comes to AI, we don't really have the standards we need, especially in healthcare. And what is it we need to look for? We talked about some problems like hallucinations. Of course, there's issues with bias, but how do we govern all of this? How do we develop it? How do we monitor it? How do we make sure that your practice is following the rules for AI and mine is as well? So really, that's the purpose of the standards. And we have different domains that we're working on, and we're working very fast to get this out. And Healthcare Standards Institute is an ANSI accredited organization. ANSI is the American National Standards Institute. So we're going down this governmental route to get these basically approved and then become the standard that people follow. And if I think that will happen because it's needed. Otherwise, how do we know what's the appropriate way to use? Which tools should we be using? Which tools should we not be using? We have to create a USB-C port for AI in healthcare.
That's a really great analogy to this. You and I, being doctors for a long time now, we recognize that change comes slow to healthcare. We still use a fax machine.
We do. Yes, it's 2025.
If 8 tracks could be used here, we'd probably be using them as well. What do you see as where is healthcare, where are we going to have to overcome some of that natural reticence to really take advantage of this power?
I think, for a very long time, we went under the premise, this is patient care, this is sickness, we're doctors, we're going to do it the way that we do it, and that's it. And we've been able to stiff arm a lot of tech for a
That's
long
a good
time.
word, stiff arm. Very
Yes,
good.
I mean, it's 2025. Typewriters have been around for a very long time, but I admitted that I was not typing notes until 2010, which was only 15 years ago. So, my God, that is not the case with AI. And in all my years of being with clinical informatics and on the tech side, I have never, and I mean never, seen anything come so fast and furious in terms of AI use for healthcare. It's unavoidable. And in fact, one of my buddies who is an informatics chief at a local hospital in town did a full AI audit of the hospital in October of 2024. And he found it already in use in areas that you might not have known. So imaging devices, CAT scanners, cardiac imaging, all of these new versions of those are leveraging AI to make the images sharper, okay? It's not giving you diagnostic info. It's just making it so that you can see better.
Right.
Well, if you can see better, then you know what it is better. Then maybe you can avoid other imaging and you can start making decisions and taking action now. So that's really the main premise, is that we're going to get into the business of decisions and actions now rather than delay. So it's already there on imaging. We have cameras that use computer vision. Computer vision is basically the AI of images that can detect retinal abnormalities at a very early onset. We have GI scopes in use today. GI Genius is one of the brands called, that basically give you decision support while the colonoscopy is moving in your colon and it green boxes and red boxes suspicious lesions. So already in play, not futuristic, in the hospital. And then, of course, a lot of software solutions. But I've definitely seen the device and imaging side far ahead of others. And now we're seeing components of Ambient and other things like that. So really, it's unavoidable. Once you start using these tools, you become hooked to it because it's so fast. It's such a time saver.
Right.
And it lowers the cognitive burden. And so like large language models for searching medical info will get you your answer in seconds instead of you spending 2 minutes to look something up on old traditional like platforms. So, wow, if I can give you info now, then our conversation shifts quicker and our, 15, 20-minute visit becomes all about discussing decisions and actions to take, shared decision-making as a physician and a patient, rather than, well, let me get back to you and we'll get that result in a week, right? Like those time gaps in a lot of cases are critical. In some cases, it's okay. But I think those time gaps are all going to squeeze decisions and actions. So every patient you got lined up in your office, boom, 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 boom. You're satisfied. Patients are satisfied. Cognitive burden is less. You're not going home to write notes till 7 p.m. I mean, you're happy. I'm happy. Everyone's going to be happy, right? So maybe. Who knows?
Well, that's an exciting future because, I don't know about you, but I wouldn't be surprised if this is the case. I went into being a doctor because of this vision I had about the doctor-patient relationship. That I grew up with a relationship with my physician. That was important. Part of it, and I saw that vision as this is the way I wanted. I want to be a doctor because of that doctor-patient relationship. Well, when I got into it and realized, okay, I have 15 minutes. We have to get through, and in that 15 minutes, I need to gather all the data. I need to hear the story. I need to, discuss the options for you, and I need us to make a decision on what's next. There's no relationship anymore. Very little,
and insurance won't pay you to stay. Well, why did it take you so long?
Exactly.
You know what I mean? So
exactly.
We're in a bad place.
And 80% of physicians now are employed by corporations who see those physicians often as interchangeable. Like, well, you can see this doctor this time and then that doctor the next time. And, it's this, though, it's still the same amount of time maybe, but now it's the doctor and the patient actually talking about what's most important.
Yeah.
And that's a beautiful thing.
I think it's beautiful. The visit time is really a travesty. But if you and I connect for 15 minutes and all we're talking about is more relevant things, I think those relationships can come back. That's the hope. I mean, that's really the hope because they're empowered, like we discussed earlier, and we're empowered. So we're getting past some of this base knowledge info things, and you already know all the info you needed to know. You know my lesion, narrowing and what the steps are for that. And then so the conversation really revolves more around that. And I got a wedding to go to next week, and how do we plan about that? So now, you have a wedding. So you know what I mean? You just bring that back.
Yeah.
That's my biggest hope, is the old school style of medicine is the new standard.
Yes. Oh, beautiful. So I do want to touch on clinical informatics.
Sure.
Not a term that most people are familiar with. If you wouldn't mind, one, what is it? Number two, how'd you get into this? And then I'm also curious, like, you're still a practicing clinician, even though your specialty is clinical informatics. Talk a little bit about that journey.
Absolutely. So informatics is really the X of information, the science of information, and how information and data is used to optimize things, specifically for healthcare, optimize healthcare delivery. Informatics is all around us. We use it for forecasting on economy, elections, all just data synthesis and creating conclusions and predictability really all encompasses the field. And we have public health informatics, we got economic informatics, we got biomedical, things that are more molecular, cellular. But for us in the clinical domain, it's clinical informatics. So it became a board specialty in 2013. So it's new, but it's not super new. And it's pretty much kind of been going from there, and really has been associated initially with being the custodians of the electronic health record. And now it's evolved more to being the AI docs. In a way, as standardized, like standardized formal training programs. And I was a previous program director for that training. So instead of doing cardiology, you could do clinical informatics. So it is an actual subspecialty. I personally got into it when I finished my internal medicine training in 2012. I decided to stay on and do this thing called Chief Residency in Quality and Patient Safety. So back then, which was not that long ago, I mean, really the understanding of quality in medicine, I feel, was not there. And we know when we talk about cars what quality is, or other elements of things that we consume, but in medicine it really wasn't there. So I did that for a year. And over the course of that year, I always found myself on the first floor with the clinical informatics department making modifications to the electronic health record. And some of the work I did, I presented nationally at the American College of Physicians annual national conference, and the chief of staff or chief medical officer took note of this and told me, hey, we got this chief health informatics officer position. It's been vacant for 2 years. Nobody wants it. What are your thoughts? And, I'm the type of person that tries to travel the road less traveled, I guess. So I took it, and 6 months into that job, informatics became a specialty. 2 years later, 2015, we had the 5th Clinical Informatics Fellowship program. 2 years after that, I became the program director. So really, it's become my whole entire career. And after 9 years, I decided to exit the health systems, and then I joined more tech and software, which is where I'm at predominantly today. All during this time, I was never, ever at zero clinical, and I was never, ever 100%. And most informatics stocks do some extent, and this was part of my negotiation when I made the switches. I need to have relevance. If I'm going to talk about AI and software used in hospitals that's going to help doctors make decisions, I have to be able to feel what they feel.
Right.
So till this day, now I'm pretty much a weekend warrior. I'll run off to the hospital about 1 week in a month, and I love it. It's fun. It's the essence of medicine, and I have my intelligence that isn't artificial because it's residence, but I've loved it till this day. It gives me my insight. I always have my finger on the pulse, no pun intended, but yeah, that's really my story.
Yeah, that's great. I also want to go a little bit different direction here as we wrap up. I've been really impressed with you and your brilliant wife. Both of you. Not only you brilliant clinicians and real thought leaders, but you're also just really interesting people.
Thank you.
Both of you. I love Dr. Amini said at one of our events. She says, "I'm fashion forward," and
Yes.
I'm like, so are you.
Appreciate it.
But you have interests in music and other things.
Yeah.
Tell us about this podcast that you
Sure.
are doing now. Has nothing to do with medicine.
Yeah.
It's just fascinating. But when you told this story, I'm like, I'm listening to that. Can you tell us what it is?
So my wife Mona is a psychiatrist, and we have both of us have this friend that was on an airplane a number of years ago, and their airplane got delayed. And it got delayed because they had to de-ice it. So she looked outside and thought to herself, who grows up thinking they want to de-ice airplanes as a career? So this idea kind of stemmed from there, that one day she wanted to start this podcast about really odd jobs that people do that really nobody knows about. And so she had this conversation with me, and I'm like, I feel like I'm that person too, because I'm in the field of clinical informatics. What's that? So we basically together co-host this podcast called Secret Job Society, and we just go after very, out of this world, but just jobs that no one really knows about, or people might have a very deep curiosity about. So we've already released season 1, and we're working on season 2. And we've, interviewed crime scene cleaners. Like, again, who grows up thinking I want to be a crime scene cleaner? We've talked to archangel activators. We've done a mindset coach. So just looking for those things that really people are like, what is that? If that comes to mind, that's the type of person that we interview. So it has nothing to do with medicine, but it's just kind of that creativity aspect that I enjoy.
Yeah, that's brilliant. So if there's somebody out there listening to this and they're like, I have the job, how do they let you know? How would they get a hold
you
of
can. There's many different ways to get a hold of me, and I'll give you my contact info. You can put it on the website, but probably the easiest way to get a hold of me, you could just email me, which is my last name, which is crazy long, Abbaszadegan, MD, MBA @gmail.com.
Oh,
that'd
brilliant.
be the easiest way.
Dr. Abbaszadegan,
yes.
What a great podcast. Thank you so much for
fun.
joining
Absolutely.
us. We have about, I'm guessing 10 more episodes we could do and
we
still
can
not
go in
cover
all
all the
sorts of
subjects.
angles,
So
yeah.
we will definitely ask you to come back and join us, but thank you for your
pleasure.
time.
Thank you.
Real pleasure. All content created by me and HealthspanMD is for general informational purposes only and is not the practice of medicine. No doctor-patient relationship is formed. The use of this information is at the user's own risk and is not a substitute for professional medical advice, diagnosis, or treatment. Hi, I'm Dr. Hurst. We created HealthspanMD for people who are dissatisfied with healthcare. Common complaints about healthcare include difficult access, poor communication, rushed appointments, disease-focused or sick care with little interest in helping people get or stay healthy, and little to offer beyond a prescription or procedure for optimizing health. This type of healthcare is unacceptable, but most aren't aware that they don't have to accept low-quality healthcare. HealthspanMD provides exceptional medical care. That means appointments when you need them, time to talk to your doctor, get your questions answered, understand your problems, and get a clear plan to achieving your health goals. But it also means a comprehensive, proactive approach to your health that goes beyond prescriptions and procedures. As a HealthspanMD patient, you will get our expert, physician-led team of doctors, health coaches, dietitians, exercise specialists, mental health, and other health professionals to help you take advantage of your best opportunities to prevent, treat, and even reverse disease. And you may be eligible to have our care model reimbursed by Medicare and some commercial insurance. If you're no longer willing to settle for low-quality health care, schedule an appointment at HealthspanMD to experience healthcare as it should be.